Welcome to the final unit of our online pharmacy practice course. This unit outlines the key consultation skills required for good pharmacy practice with video examples of good and bad consultations. By the end of this unit, you should be able to explain why it is essential to have good consultation skills, understand the elements of a good consultation, and distinguish between good and bad elements of a consultation. We will begin by talking about why good consultation skills are important. Firstly, in a UK community pharmacy, the pharmacist sees over 100 patients per day, whilst typically a hospital pharmacist looks after 20 to 40 patients. Good consultation skills are therefore essential to build a rapport with a patient, as this leads to a positive pharmacist-patient relationship. This can further facilitate better patient outcomes and increase adherence. As you may know, the term adherence is used to describe patients following a course of action from a shared decision, rather than health professionals telling the patient what to do. By coming to a decision together, the patients will be more inclined to take their medications as prescribed, as their concerns will have been heard. For example, there may be a reason why the patient does not want to abide by the treatment regimen if they have swallowing difficulties. By exploring the patient's need, the pharmacist can identify issues and come up with a solution, such as changing the formulation. This may empower patients to gain control of their lives and make decisions on their health management, lifestyle, and social circumstances. Good consultation skills are also important in reducing conflicts stemming from patients' confusion. Furthermore, thorough explanations by the pharmacist can promote the respect and recognition of pharmacy professionals. For these reasons, good communication skills should form a part of continuous learning. So now that we understand the importance of good consultation skills, we will begin to explore what good consultation skills are. Some examples include eye contact, having an open body language, listening to patients' concerns and offering solutions, explanations of treatment regimens, checking patients' understanding, and appropriate reassurance. Now that we have explored what good consultation skills are, we will look at the opposites. As you can imagine, there are daily challenges of good communication skills, such as having a lack of time, and especially when we get a chatty patient who digresses throughout the conversation. The following examples are just some general poor consultation skills, as we cannot say that one size fits all. This is because the pharmacy environment can vary a lot daily. A lack of introduction is considered bad practice. Introducing yourself before a consultation is very important, as it allows the patient to understand who you are and what you do. This will help towards delivering patient-centered care, and it is something that you should do whenever you are speaking to a new patient. Other poor consultation skills include poor body language, expressed by the crossing of arms or fidgeting, such as playing with your hair, thus diverting your attention away from the patient. Interrupting patients or looking distracted should also be avoided during consultations, as vital information can be missed out. It can also be seen as rude and unprofessional and potentially give rise to conflict. Use of medical jargon should also be avoided, as patients may not understand. This could be a barrier to adherence and building of a pharmacist-patient relationship. For example, instead of explaining to the patient that they should not drink grapefruit juice with simvastatin, as this can cause an increased risk of adverse drug reaction, such as myopathy, the pharmacist should instead explain that the patient should not drink grapefruit juice with simvastatin, as this can increase the chance of side effects, such as muscle weakness. Can you see a difference there, and how the second explanation would have been easier for the patient without any medical knowledge to understand? On the next slide, there will be a video demonstration of a poor consultation. Please watch this closely and note down as many bad consultation skills demonstrated as possible.
Can I help?
Yeah, I was just wondering whether you've got any treatments for bladder infection.
What makes you think you've got a bladder infection?
I've just been experiencing some slight pain when I go to the toilet, and I've noticed some cloudy urine
Oh, right. How long have you had that for?
since yesterday morning.
Okay. And have you had anything like that before?
No, this is the first time.
Right. Are you on any medications, or do you suffer from any medical conditions or any allergies?
Yeah, so I'm currently, I'm asthmatic, so I'm currently taking salbutamol and salmeterol.
Okay, no allergies.
No.
Right. Okay. It sounds like you've got
Okay,
cystitis.
what's
You
cystitis?
should take this, and everything you need to know is in there. It should clear up the infection. If it doesn't, just go see your GP.
Okay, is there anything...
Okay. Oh, remember to drink plenty of water. That will help prevent this from happening again. Okay.
Okay,
Thanks.
I will.
Bye bye.
Bye. We hope you enjoyed that video demonstration. How many poor consultation skills did you spot? Here are some answers. Lack of eye contact, looking distracted, inappropriate questioning, interrupts patients, use of medical jargon, lack of counselling, and a dismissal of patient's question. The next slide will show a video demonstration of a good consultation. Again, please watch closely and try to see how many good consultation skills you can spot.
Hi. How can I help?
Hi, I'm just wondering whether you've got any medications for bladder infection.
Okay, there's just a series of questions I need to ask before I can make any decisions. Before that, can I confirm that whether the medication's for yourself or for somebody else?
Yeah, so it's for myself. I've recently been experiencing some slight pain when I go to the toilet, and I've noticed some cloudy urine as well.
Okay, so how long have you been experiencing these symptoms for?
Since yesterday morning.
Okay, and are you experiencing anything else apart from these?
No, just those symptoms.
Right, and just to check, are you currently on any medications or suffering from any medical conditions or have any allergies?
No, but I am asthmatic, so I'm currently taking salbutamol and salmeterol inhalers.
Okay, and just to rule out, is there any chance that you could be you could possibly be pregnant or breastfeeding?
No.
Okay, so from this information you've given me, it does sound like you do have a bladder infection. What I can recommend is this cystitis relief, which contains sodium citrate and it's in a granular form.
Okay.
And all you have to do is dissolve 1 sachet of that in a glass of water.
Okay.
Take that 3 times a day and take it for 2 days. And you should notice that your symptoms will clear up.
Okay.
If your symptom doesn't clear up, then you may have to refer to your GP.
Yeah, okay, sure, yeah, I'll just give that a try then. Sounds
Okay.
good.
Yeah, just to check your understanding, can you repeat the instructions back to me?
Yeah, so dissolve 1 sachet in a glass of water.
Yeah.
3 times a day for 2 days.
That's correct. Just for your future references, make sure you drink plenty of water throughout the day, as that will help prevent this from happening again.
Okay, yeah, that sounds good. Yeah.
Is there anything else you'd like to know?
No, that's everything. Thank you very much for your help.
Okay, thank you. Bye-bye.
Bye. Here are a few examples of the good consultation skills demonstrated in the previous video. How many did you get right? Eye contact, open body language, thorough questioning, thorough counselling, and checking patients' understanding. The next slide will show a summary of this unit. To conclude, we have explored the importance of consultation skills, and this can lead to building a rapport with a patient to improve patient outcomes, reducing the likelihood of conflict and promoting the pharmacy profession. We have also identified differences between good and poor consultation skills and know that the main elements of a good consultation involves eye contact, attentive listening, exploring patients' concerns, open body language, and explanations of treatment. To challenge yourself, perhaps try to incorporate some of these good consultation skills to your daily practice whilst talking to patients. Please have a go at the quiz to test your understanding and further consolidate what you have learnt from this unit. Just on a final note, thank you so much for participating in our online pharmacy practice course. We sincerely hope you have enjoyed the content within this course and that it will help with your future pharmacy practice. We would be really grateful if you complete a short questionnaire. This will help us develop our course delivery and perhaps produce further online pharmacy courses from the University of Manchester. Goodbye for now.